Take a second right now and just blink your eyes. Okay, now swallow. Now look to your left and then over to your right. Have you ever wondered how exactly your brain commands your body to do all of that? I mean, how does it control your facial expressions, let you smell your morning coffee, hear your favorite music, keep your balance, and perfectly regulate your speech? It honestly feels a bit like magic, right? But the actual answer lies in a highly complex, beautifully orchestrated network of neural pathways.
Welcome to This Explainer. Today, we're diving into what I think is one of the absolute most fascinating topics in human anatomy and physiology. Our goal here is to completely simplify the 12 cranial nerves. Whether you're a medical student prepping for those high-yield exams, a healthcare professional brushing up, or really just a curious learner, we are going to break down this extraordinary communication network between the brain and the body. And we're going to do it in a way that's clinically relevant and, most importantly, incredibly easy to understand.
So, here's our roadmap. We'll meet the nerves, cover the pure sensory nerves, the eye movement nerves, the face and jaw, and the lower nerves, including the famous vagus nerve. And then we'll wrap the whole thing up with vital reflexes and some essential memory tricks.
Okay, let's jump right into Section 1, Meet the Cranial Nerves.
So, we have 12 distinct pairs of cranial nerves, and what makes them so special is their origin point. You see, unlike your spinal nerves, which branch out from the spinal cord to supply your limbs and your torso, these 12 extraordinary pairs are wired directly from the brain and the brainstem. From there, they emerge to supply the head, the neck, and your special sensory organs. They're basically the direct, high-speed lines of communication for your most crucial daily functions.
Now, it's absolutely crucial to understand that these nerves carry different types of fibers. Distinguishing between sensory, motor, and mixed fibers is a classic, foundational, high-yield concept. You will definitely see this on exams. We have sensory-only nerves, which are cranial nerves I, 2, and 8. We have motor-only nerves like 3, 4, 6, 11, and 12. And finally, we have mixed nerves that do a little bit of both, which include V, 7, 9, and 10. Keeping this simple framework in your head makes learning their individual functions so much easier.
Moving on to Section 2, Pure Sensory Nerves. Let's explore how we actually interact with the sensory world around us. Think of these three as your dedicated sensory cables: cranial nerves I, 2, and 8. Cranial nerve I is the olfactory nerve. It is responsible entirely for smell, using receptors in your nasal mucosa to send signals straight into the brain. Next up is cranial nerve 2, the optic nerve. Light stimulates the photoreceptors, your rods and cones, converting those signals into neural impulses that travel from the retina through the optic chiasma and tract, right back to the visual cortex. And finally, we have cranial nerve 8, the vestibulocochlear nerve. This one has a cochlear part for hearing and a vestibular part for your balance and equilibrium.
But why does this matter clinically? What's the so what? Well, if you have a viral infection, head trauma, or a neurodegenerative disease affecting cranial nerve 1, it can lead to anosmia, which is the total loss of smell. Similarly, damage to the optic nerve, cranial nerve 2, results in devastating visual loss, or specific visual field defects. And issues with cranial nerve 8, those can result in profound hearing loss, or intense vertigo. Once you understand the normal pathway, you can instantly diagnose the deficit.
All right, Section 3, the eye movement nerves. This is an incredible display of synergistic teamwork.
It's really fascinating how this physiological teamwork builds. Eye movement isn't controlled by just one single nerve. It's a perfectly coordinated effort between 3 of them: cranial nerves 3, 4, and 6. Cranial nerve 3, the ocular motor nerve, supplies most of your extraocular muscles, and it also controls eyelid elevation and pupil constriction. Cranial nerve 4, the trochlear nerve, specifically supplies the superior oblique muscle. And cranial nerve 6, the abducens nerve, supplies the lateral rectus muscle. When cranial nerves 3, 4, and 6 fire perfectly together, you get smooth, coordinated eye movements.
Now let's contrast normal eye function with a nerve palsy because the clinical presentation is striking. If you have a cranial nerve 3 palsy, the patient will have ptosis, which is a drooping eyelid, a dilated pupil, and their eye will literally rest looking down and out. Alternatively, with a cranial nerve 6 palsy, because that lateral rectus muscle is compromised, there is a complete inability to abduct the eye. That means the patient simply cannot look outward.
Which brings us to Section 4, the face and jaw. We're bridging the gap between deep sensation and outward expression.
We are looking at 2 highly complex mixed nerves here. First is cranial nerve V, the trigeminal nerve. This is the major sensory nerve of your face, and it's divided into three mighty branches: the ophthalmic, maxillary, and mandibular divisions. It handles sensation for your face, your cornea, and your oral cavity, while also providing motor control for your muscles of mastication. So, it's what lets you chew your food. Beside it, we have cranial nerve 7, the facial nerve. This nerve is the absolute master of facial expression. It also handles taste from the anterior 2/3 of your tongue, and it triggers lacrimation and salivation. Tears and spit, basically.
To truly grasp the importance of the facial nerve, let's look at a classic clinical mini-narrative, Bell's palsy. When the facial nerve is completely healthy, you can smile symmetrically and wrinkle your forehead without a problem. But in Bell's palsy, which is a lower motor neuron facial paralysis, that entire system fails on one side. The patient will present with a distinct facial droop, an inability to close their eye on the affected side, and a complete loss of forehead wrinkling. It's a very striking clinical reminder of cranial nerve 7's power.
Moving down to section 5, lower nerves and vagus. These are the systemic nerves that manage your most crucial subconscious life functions.
Meet the mighty vagus nerve, cranial nerve X. The vagus is without a doubt one of the most important parasympathetic nerves in the entire human body. Its vital superpower is systemic regulation. It actually travels far beyond the head and neck to supply your heart, your lungs, and your gastrointestinal tract. Physiologically speaking, increased parasympathetic activity from the vagus nerve directly results in a reduced heart rate. It is the ultimate rest and digest controller.
And surrounding the vagus, we have three other really critical lower nerves. Cranial nerve I, the glossopharyngeal nerve, handles taste for the posterior 1/3 of the tongue. It assists in swallowing, and it controls parotid gland secretion. Cranial nerve axi, the accessory nerve, supplies the sternocleidomastoid and trapezius muscles. That's what allows you to elevate your shoulders and physically rotate your head. Finally, cranial nerve xi, the hypoglossal nerve, is entirely dedicated to controlling the intricate, precise movements of your tongue.
So the crucial takeaway here is how these lower nerves manifest when they get damaged. If the vagus nerve is compromised, a patient might experience dysphagia, which is difficulty swallowing, along with hoarseness and a uvula that deviates away from its normal position. Conversely, if there's a cranial nerve 12 palsy affecting the hypoglossal nerve, the tongue will visibly deviate directly toward the side of the lesion when the patient tries to stick it out.
Finally, section 6, reflexes and memory tricks. Let's do a rapid-fire review of high-yield pathways to really lock all of this in.
Reflexes are, simply put, beautiful sensory-to-motor pathways. Let's trace two of the most important ones. For the pupillary reflex, light entering the eye is sensed by cranial nerve 2, the optic nerve. That sensory signal is routed to the brain, which immediately fires back a motor command via cranial nerve 3 to constrict the pupil. For the corneal reflex, touching the cornea sends a sensory alarm via cranial nerve 5, the trigeminal nerve. The brain then responds by sending a motor command right down cranial nerve 7, the facial nerve, causing you to instantly blink. It's always sensory in, motor out.
The gag reflex operates on that exact same elegant logic. If something touches the back of the throat, cranial nerve I9, the glossopharyngeal nerve, acts as the sensory limb, alerting the brain that something is there. The brain immediately fires a protective motor response back down through cranial nerve 10, the vagus nerve, initiating the gag. Again, sensory in, motor out.
Okay, so how in the world do you remember all 12 of these names in order? I highly encourage you to grab a quick screenshot right now. The classic name's mnemonic is oh, to touch and feel very good velvet, such heaven. That gives you olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. Trust me, it is an absolute lifesaver for high-yield exam prep.
And what about remembering which specific nerves are purely sensory, purely motor, or mixed? Well, we've got a classic, slightly silly but incredibly effective mnemonic for that too. Some say marry money, but my brother says big brains matter more. The S stands for sensory, the M stands for motor, and the B stands for both, or mixed. Just match this up sequentially from nerve 1 down to 12, and you will literally never classify a cranial nerve incorrectly again.
We have covered a lot of ground today, from the sensory cables that let us experience the world to the intricate pathways that coordinate our eyes, animate our faces, and silently regulate our internal organs. The cranial nerves truly form an absolute marvel of an extraordinary communication network. So, I want to leave you with this thought. How will mastering this incredible anatomy change your clinical perspective? Because whether you're diagnosing a facial droop or understanding the root cause of vision loss, applying this knowledge in the real world is what true medical physiology is all about. Keep exploring, keep questioning, and thank you so much for joining me on this explainer.